Presentation is intended to supplement consultation, enhance patient knowledge, and to allow for thoughtful consideration of treatment options. It is not intended to provide freestanding medical advice without an appropriate corresponding medical evaluation. Treatments mentioned in this presentation may not be appropriate for your needs based upon your specific medical history. Please be sure to discuss your specific medical history, medications, and allergies with your physician at the time of your visit, and please ask your surgical team if there are any unique circumstances to your proposed surgical intervention. Rotator cuff refers to a group of muscles and tendons that connect the shoulder blade or scapula to the ball of the upper arm bone called the humeral head. There are 4 muscles in the rotator cuff. From front to back, they are the subscapularis, supraspinatus, infraspinatus, and the teres minor. The tendons of the rotator cuff cover the humeral head, and all work together to help lift the arm and hold the humerus in place to allow for smooth shoulder function. When the rotator cuff is torn, it can cause pain, weakness, and patients often have trouble sleeping at night. Some tears can impact shoulder function as well. The picture on the left is a drawing of a supraspinatus tear, and on the right is an intraoperative photograph of a supraspinatus tear. A torn rotator cuff can be repaired by arthroscopic, mini-open, or open techniques. This video will review arthroscopic rotator cuff surgery in more detail. During arthroscopic surgery, several small incisions called portals are used to insert a camera and various instruments to repair the tear. This is different from open surgery, where a larger incision is created to allow the surgeon to look directly inside the shoulder. Additional damaged or abnormal structures inside the shoulder are often addressed at the time of arthroscopic surgery. Here we can see a torn rotator cuff tendon. A tissue grasper is taking the tendon tissue and reducing or putting it back in the position of its anatomic attachment, known as the greater tuberosity. In order to repair the tendon back to bone, sutures must be inserted into the bone itself. Various different techniques can be used for this. Depicted in this video, an instrument is inserted into the bone to create a tunnel to allow for a bioabsorbable plastic screw to be inserted. Suture anchor or bioabsorbable screw is now inserted into the bone, effectively trapping the sutures into position. After the suture has been anchored to the bone, a suture passing device is then used to shuttle the sutures through the tendon and facilitate repair back to the bone. The sutures can either then be tied in place or placed into additional anchors at the edge of the bone. The final repair is visualized from the lateral portal, demonstrating attachment to the greater tuberosity of the humeral head. After the repair is complete, the arm is taken through gentle range of motion to ensure the repair is secure. The incision sites are then closed and a sterile dressing is placed. The arm will be then fit with a sling that will be required to be worn to protect the rotator cuff tendon following its repair. Recovery from a rotator cuff tendon repair is usually a long process. Even a small tear may require 6 to 8 weeks for the tendon to heal back to the bone. Full healing may require 6 months to a year. You may also need to take pain medications for a short period after the surgery. Your doctor will give you instructions on how to take the medication safely and how to manage any side effects. It is important to follow your doctor's instructions carefully and attend all follow-up appointments to ensure that your recovery is going well. The shoulder sling is usually discontinued by 6 to 8 weeks, and activities of daily living are allowed then. Office work may begin the week after surgery, but return to more physical jobs and sporting activities will require a longer healing time. For most tears, 6 to 9 months is required for full return to unrestricted activities. With proper care and rehabilitation, most people are able to regain full function of their shoulder after rotator cuff surgery. Each case is somewhat different, and unique aspects of your surgery will be discussed with you. The benefits of rotator cuff surgery depend on each individual case, but generally include reduced pain, improve shoulder function, prevention of further rotator cuff damage, better quality of life, and it is important to note that not all rotator cuff tears require surgery, and that the decision to have surgery should be made in consultation with an orthopedic surgeon after careful consideration of the individual case. The potential risks and benefits of surgery should be considered thoroughly before making a decision. The complication rate for arthroscopic rotator cuff repair is low. However, all surgeries typically involve pain, and frequently narcotic medications are prescribed, which do carry their own risks. Surgical complications can include infection, which occurs less frequently in arthroscopic surgery compared to an open procedure. Nerve and blood vessel injury is rare. Scar or keloid formation can occur. Stiffness after shoulder surgery is common, and a small percentage of patients may require a second procedure for release of scar tissue. The main concern following rotator cuff surgery is the tendon may pull loose from the bone and fail to heal. It is important to remember that not all tears are repairable, and the tendon that remains may be so damaged severely enough that it is unable to hold stitches, or the bone may be too soft to hold the anchors. Some individuals may have lost too much tendon tissue to have the tendon repaired back to the bone. Most tears are able to be surgically repaired to the bone, but your body must heal the tear. It's also important to stay within the prescribed restrictions your surgeon provides you following surgery. Medical complications are a possibility after surgery. These can include and be as severe as heart attack, stroke, or death, respiratory failure requiring hospitalization, pneumonia, and blood clots can also occur. Medical literature has noted each of these complications to be rare and occur at a frequency of less than 1%. If you have a prior history of any of these conditions, you will typically be asked to meet with your primary care physician to discuss strategies before surgery to decrease the risk of these complications. General anesthesia or going to sleep for surgery can often be supplemented by what is known as regional anesthesia. This is commonly referred to as a nerve block. For rotator cuff surgery, an interscalene nerve block is commonly performed to provide pain control during the surgery and immediately after surgery. It involves a small needle that is used to numb the nerves in the neck that go to the shoulder, arm, and hand. This numbing medication helps to relieve pain during and after the procedure, and it can last for several hours. To perform an interscalene nerve block, the patient will typically lie on their back with their head turned to the side. The anesthesiologist will then use a small needle to inject the numbing medication into the area around the nerves in the neck. The patient may feel a small pinch or pressure, but they should not feel pain during the procedure. Benefits of the nerve block can include improved pain control immediately following surgical intervention. Typically, less narcotic medications are required during surgery, which will decrease the risk of side effects from these medications. After the nerve block, the patient's arm, shoulder, and hand will feel numb or weak for several hours. This is normal and will go away after the medicine wears off. Some risks associated with general anesthesia can include allergic reactions, breathing problems, nausea and vomiting, confusion and memory loss, injury or damage to the teeth, lips, or tongue, as well as medical complications such as heart attack, stroke, and death, as previously listed. It is important to note that this is not an exhaustive list, and you are encouraged to talk to your anesthesia provider about any specific risks you may have before undergoing general anesthesia. They can help you understand the risks and benefits and determine the best course of action for your individual case. While an interscalene nerve block is generally considered safe, potential risks include bleeding or infection at the injection site, difficulty breathing, allergic reactions, nerve damage, hoarseness, collapsed lung or pneumothorax, seizures, deep infection, or blood vessel injury. You are encouraged to discuss each of these risks with your anesthesiologist prior to the procedure. There are several alternatives to rotator cuff surgery that can be dependent upon the individual tear as well as individual patient's needs. These include rest, modification of activities, physical therapy, typically anti-inflammatory medications, corticosteroid or platelet-rich plasma injections, or modalities such as dry needling or acupuncture. While non-surgical treatments like rest, physical therapy, and medications can be effective for many patients with a rotator cuff tear, there are some underlying risks of non-surgical management, which can include risk of long-term tear size progression, including enlarging to the development of arthritis or loss of mobility. The success rate of rotator cuff repair surgery can vary depending on factors such as the size of the tear, patient age and overall health, as well as the type of surgery performed. However, the overall success rate of rotator cuff surgery is generally considered to be high. It is important to note that in addition to these factors, success can be dependent upon tobacco usage, and it is recommended for smoking cessation around the time of surgical intervention, as well as compliance with postoperative rehabilitation programs, taking care to follow prescribed restrictions from both therapists and the surgeon.